What is scaffolding? So when surgeons talk about using scaffolding in breast surgery in particular, we're going to use some kind of material during surgery to better support the breast so it stays in the right location. So sometimes we're supporting the breast itself, and sometimes we're just supporting an implant. So in general, a majority of people use one of two things for scaffolding in the operating room. Thing number one is dermal matrix products. So these are products that come from an animal, either human or pig, and it's dermis, so the lower strength layer of skin, and we use that as our scaffolding. And then the other option is mesh. And nobody that I know of uses permanent mesh. We all use dissolvable meshes. So everybody gets panicky when I talk about this and think we're talking about the vaginal mesh that you see the scary commercials for. This is not that. This is a different type of mesh. Here's the two most common ones that I see used. Oh, there's a third one, but I don't have a sample of it. This is tiger mesh right here, and this is Galaflex. So these meshes dissolve and they leave behind a little firmer collagen than you would have made. So you end up with like a collagen hammock holding things up, whether it's the breast or an implant. And there's some other things used that I don't see used as commonly, like there's one that's actually made from sheep rumen. There's some other random things that we use for scaffolding, but that's basically what it is. It's something that we use in addition to your own body's tissue to support the breast or an implant. And then it's always important to note that these things, no matter what type of scaffolding, dermal matrix, mesh, whatever, none of these things are FDA approved for use in the breast. They were approved, pretty much all of them, for just a general soft tissue indication, but they weren't specifically approved for breast. We still use them off-label, but that's what their approval's for. And there's studies on all of these things. They're commonly used in the breast, but they did not go through the FDA approval process, because there's always someone that asks me about that in the comments. So these scaffolding products can be used to prevent problems, but also to solve problems. They're really useful in breast surgery, and we use them extensively in both cosmetic surgery and reconstructive surgery for our cancer patients.